are officially recording for this lecture on first clinical rotation. And now here is Dr. Ruskin.
Thanks for that intro. Okay, so first clinical rotation, these are the topics I'm going to talk about. And so this is going to take a little time, probably about an hour to 2 hours to talk about. And you're free to ask questions anytime that you want, okay? All right, so your first rotation is 2 weeks long, and you need to achieve 80 hours in those 2 weeks. Remember that there's no built-in time off during your clinical rotations. So even if you have an important family event like a wedding, a graduation, or anything like that, you cannot take time off for that during your clinical rotations. And remember, that's also the case for your 7-week rotations, which start in November. Even for transportation issues, let's say your car dies or something like that, but you need to have something lined up for your clinical rotation weeks, either a ride from a friend or Uber, the bus, your bike, something like that. You need to have an alternate route of transportation so that you can get to clinic, even if something happens to your primary mode of transportation. So that's why it's good to actually think about these things ahead of time so you can line up some help. The other thing is, let's say you have kids or an elder that you're taking, that you have responsibility for, or that you're a caregiver for. You do need to line up other options for when you're in clinic, because you really can't, as a student, you can't, at noon say, oh, I have to go because my child's sick at school or something like that. You need to have someone else who can pick them up, or some kind of alternate arrangements. Also, you cannot try to negotiate different schedule because of your job, or you cannot take time off to go to doctor or dentist appointments. Plan those for before or after the clinical rotation. So 100% attendance is required to pass. Now, let's say that something terrible happens, knock on wood that it doesn't, like a car accident, you get admitted to the ER, or you have a death in the immediate family, which only includes parents and children, not aunts, nephews, nieces, anything like that, but only parents or your direct children. Then contact me immediately, and I will help you work through that. But I can't guarantee that you will be able to get enough hours to pass the rotation, which would then mean that you would withdraw from the program and rejoin the next cohort at the same point that you left. So if you weren't able to pass the clinical rotation, then you would come back with cohort 13 for the clinical rotation and restart the program there. What happens if you get to the last day on August 30th and you have less than 80 hours? For instance, if you were admitted to the emergency room and you couldn't make it back to do makeup hours before the next semester starts, we can work on trying to get you makeup hours, but no one can guarantee that the clinic will have makeup hours for you. And so that's why you need to try your very best and attend when you're supposed to be there, to try to get your hours before the end of August 30th. If we are not able to get makeup hours, then you can't pass, and you'd have to withdraw from the program and come back with cohort 13. So that's why you should avoid all absences, all latenesses, because every hour counts. Even if you have one less hour than you need, you can't pass. So don't be late for your shifts, because that adds up. And also, I would caution everyone, don't make plans for the week off in between semesters, which is, I think it's the week of September. Well, it starts September 1st, or August 31st. Yeah, August 31st. And it goes until the start of the next semester. So that's a week. In the past, some students have made cruise ship travel plans, or they're flying to the East Coast or something like that. And then they end up with 10 hours missing that they need to make up during that week. And so they had to cancel their travel plans. So even though it's a week off, I would caution you, don't make out of town plans or plans that you can't cancel, because you may need that week for makeup hours. And that goes for every rotation.
What? Oh, sorry. What if, say, you're on your last week and a COVID breakout happens in the clinic you're at? What happens then?
Very, very, very good point. And you guys are like, you're living this reality right now. That could prevent you from finishing your hours by August 30th. And then if you, it depends on the clinic's policy, because every clinic is different. In general, I think they're following CDC policy, which says like a week of quarantine and a negative test. But some places say if you go a couple of days and you don't have any symptoms, you can come back. So I would help you follow the clinic policy, the facility policy. We'd try to get you back into the clinic as soon as possible to finish your hours, hopefully before September 6th, I think is the start of the next semester. And if we can get that done, then you can continue in the program. But let's say you got exposed to COVID and you got sick and you were sick for 3 weeks and you couldn't finish your clinical rotation before the next semester starts, you would be withdrawn from the program and you would have to rejoin with cohort 13 because of illness. But that's the same thing for, let's say you got sick with flu and you were sick for 3 weeks, or you broke your leg and you couldn't go to clinic for a month. So this policy has, it's covered everything like that even before COVID. So, you know, if for any reason, any sickness, or let's say you have a gallstone or, anything, or an appendix removed or something like that, and you're not able to finish your hours before the first day of the next semester, that's the same thing. You would have to withdraw and then resume with the next cohort. Make sense?
Yeah.
The thing about COVID is you can prevent a lot of problems by wearing a good fitting mask and getting vaccinated. And so if you want to reduce your risk to the very lowest possible, for getting your program interrupted by COVID, that's what you want to do. You want to get vaccinated and you want to wear a really good mask. Maybe you want to get an N95. Maybe you want a double mask if you're using cloth masks. Maybe you want to wear eye protection, which you saw me wear in class on Tuesday. And then maybe you want to wear scrubs over your clothes so that you don't wear your scrubs inside your house. There's a lot of things that you can add to what you're doing for COVID protection that you can do. Okay, and if I'm very willing to give advice on that. Mr. McKeever and I have done a lot of research on this, and you see us doing certain things, and then there's other things that are more invisible that you don't see that we're doing that we can advise you on if you're interested. On Blackboard, there's a checklist of the required documents that you need to turn in during the practicum in order to, I see a chat, I'm trying to get to it here. Is it safe to assume that our CIs won't be taking PTO? You mean vacations?
Paid time off, yeah.
Right. Oh, no, I can't guarantee that. And in some cases, your CIs will be taking a day off here or some vacation time off, sometimes to go to courses or whatever reason it is. And they will place you with someone else. They'll arrange that you'll be with someone else. And that's awesome because then you get to see how someone else works with patients and you see their style and you get to learn their way of thinking as well. So it's okay if they do that. They'll normally make arrangements. If someone's going to be out of town or out of the clinic and they don't have anyone else to put you with, they usually notify me and say, look, I don't think this is going to work out. I think you better find a different place for the student. And that's when I would get a different placement for the student. Good question. Okay, so on Blackboard, there's a checklist that you should download, and it has everything that you need to make sure that you turn into me and Blackboard to pass the practicum. And here are the sections on the checklist. So there's a section prior to the first day, and you guys have already done this. You've written and sent your email, your introductory letter, and you've submitted your CI contact information to Blackboard. So those were all during the prior to your first day. Some students will have orientation or further tasks to do. Some people have to do another background check. Some people have to get a flu shot. Some people have to attend an orientation on property, you know, like their employee orientation, and each student is doing that on their own. Then you have some things you have to do on the first day. So first of all, as soon as you arrive on property, you need to clock in. And I've been trying to set up the timesheet. That's what I use the CI contact information for that you submitted. Most of you have your timesheets set up already, and you'll see that on your student portal. Everyone needs now to have their student portal on their phone, because this is how you're going to clock in every day and clock out using your phone. So when you go into student portal, you will see something called timesheet, and you would go into that and just clock in for the day. And then right before you leave for the day, you're going to clock out, and that goes straight into the PMIS system. Is the student portal app different from the Blackboard app? Yeah, it is. Mr. McKeever, do you know what the student portal app is called?
I'm actually looking that up right now because I wasn't even aware there was one. So I'm looking it up right now. So give me a few seconds. I'll talk more intelligently about that in a few minutes.
Thanks so much.
Yeah, I got to look it up.
So anyway, you're going to be clocking in and clocking out using your phone. So you need to have your phone with you every day. It needs to be charged, and you cannot clock in and clock out off property. So you can't clock in from home. There is a geocaching feature on the timesheet, and it shows me where you clocked in from. So you have to be on property when you clock in. All right, and a little closer to the time, we'll take out your phones and take a look at the timesheet, or you can look at that yourself. Anyone who has not submitted CI contact information to Blackboard does not have a timesheet yet, because I need your CI's updated email or their preference for their email to be able to set up your timesheet. So you guys won't have that on your, there's a couple people that haven't, they don't know their CI's email yet. So I'll set that up when you have that.
I have a quick question, Dr. Rustin.
Okay.
So you said we have to be like on the property for clocking in. Do we clock in walking into the facility, or can we do it like in our car right before we walk in, so we're not like have our phones out?
That's a good point. You can do it in your cars as long as you don't get there like an hour early.
Okay.
You don't clock in before your like an hour before your scheduled time. Clock in 10 to 15 minutes before you're supposed to walk in, and then go in 10 minutes early. You should be early before your schedule starts. But I think the less they see your phone, the better they think of you. That's the point.
Okay. Yeah. Thank you.
Yeah. Okay. So the first thing that you do on your first day is clock in, then you go into the clinic and introduce yourself. And then your CI is going to say, okay, do you have any forms that we need to work on? And you do have a safety orientation form. It's a very short form that they show you the emergency exits, the fire extinguishers, and things like that. You initial those, and then a staff person needs to sign off, and it doesn't have to be your CI. If it's a receptionist that shows you where everything is, they can sign the form. That's fine, because I know sometimes the CI has to go and actually start treatment on the first patient. There's another. It's a survey that you have to do. It's a CI verification, and this is you're going to sit down with your CI and ask them the questions on the survey, and you're going to put the answers in yourself. Okay, it's just a way to start a conversation to help you to get to know your CI, because I know things can be awkward on that first day. In addition, the school is required to have that information for you to submit that information about your CI. It's things like, do they have any specialty certifications, and just questions like that. It's just a nice way to get to know your CI. So when you guys have a moment, you'll be asking them those questions. And the link to that is on Blackboard. So you can access everything you need on Blackboard, except the timesheet. That's on Student Portal. And then you're going to start discussing with your CI on your first day, your goals for the first week. Did you guys all see that post from Mr. McKeever?
Yes.
Yeah, you can access it from the website. Or
Yeah, I just didn't want to interrupt while you're talking, so that's why I just typed it in. But yeah, it looks
Yeah,
like it's just logging into the website itself.
yeah. So you might want to bookmark that website so that you have quick access each day. Okay, and then the other thing you're going to start, but you're not going to finish on your first day, is you're going to develop some weekly goals. And actually, we're going to work on that today a little bit before we go, or that can actually be a really good attendance assignment for today. But I'll work with you on that at the end of the presentation.
I like that idea.
Yeah. So what it entails is you are going to think about your weaknesses as a student and your strengths. And then looking at your weaknesses, you're going to devise some goals for your first week. Okay, so if you feel like you're weak in ultrasound because you've never done an ultrasound on a real patient, that would be a really good goal for your first week, is to do an ultrasound on a real patient. If you've never written a SOAP note, which none of you have for a patient, that's a very good goal for your first week too. So that's a goal for everyone that anyone can put down, but we'll talk more about that after. And that's going to be due at the end of your first week, your goals. Your first week ends on a Tuesday, right? Because it starts on a Wednesday, ends on a Tuesday. So your first Tuesday is the end of your first week. And at that time, you're going to submit your timesheet to your CI. And there's a particular button on there where you send it to your CI. You don't want to do that daily. You just want to send it at the end of the first week. And then they're going to approve it and send it to me. And then I approve it and it's accepted by PIMA. And then you submit your weekly goals completed. And by the end of the first week, you also have to finish a clinical site description form, which is a form where you walk around the facility and you find out about the facility. It's a way for you to discover what the facility has to offer. So you're going to be asking, like, what are the hours of the facility? How many people work there? Does anyone accredit the facility or no? You don't have to get the accreditation. You just have to find out, like, do they have to go through accreditation? Because I know students don't know about that stuff. So it's something for you to think about. Yeah, I was going to show examples in a little bit. Okay. Okay, your second Tuesday is the end of your rotation because it's the end of your second week. And of course, then you're going to submit your second week's timesheet, your second weekly goals form. So you're going to have different goals for your second week. And then a documentation of learning experiences. This is a checklist of stuff that you did. And it's just, you don't have to get your CI to sign it. I just want to hear from you. What did you get to do? Did you get to put a hot pack on someone? You check that. Did you get to do gait training? You're just going to check that. Okay, so it's just a record of the things you got to do. And there's no right or wrong answers. You just report what you did. And then you get to give me feedback about your experience. And that's the student evaluation survey. So you just answer questions that are on there like, you know, how was your CI? Did the facility welcome you? Did you feel like you learned a lot? Did you feel like I supported you through your experience? So it's a lot like a Compass Pro survey. Okay, so those are all the things that you as a student have to do. And actually, they're all pretty easy. The CI does have to do two things in order for you to receive a final grade. they have to fill out what's called a student performance summary. And I actually am not going to show that to you guys. I'm going to describe what's on there, but it's not something that the student, you don't get to look at it until they fill it out, and then you get to see what they said, and then you get to sign it. Okay, so it has 7 categories, I believe, and I'll show you what those are so that you know what you're being judged on. And they're going to rate you as acceptable or not acceptable, and then they're going to say whether they think you should pass or not. It's just a 1-page form. It's very fast for them. It's not a lot of work for them. The other thing I need from them is a survey. Just like you get to fill out a survey about your experience, they need to give me their feedback too. They're going to give me their opinion on how well prepared you were, if they think the school is doing a good job with their students, and also did I support them, the CI, during the 2 weeks. So I get rated. And both of those, I have to get both of these things from the CI in order for you to get a final grade. And so you as a student, you do have to remind them that they have to submit these by your last day, or I have to give you an incomplete. Okay, so it is part of your job to remind them. And I'll be sending them reminders too, but you have to be involved too. Has Pima had good feedback for students in this area? Do you mean about students?
Yeah, I meant to say like about students, from what the CIs have said, like there hasn't been anything crazy.
Yeah, we normally get usually 100% good feedback that students are well prepared. Once in a while, there'll be a CI who has, very high standards, and they say, oh, well, we think the students should be better prepared in such and such topic. And then my job is I bring that to the faculty and I say, okay, this is what the CIs are saying. They'd like a little more preparation in this area. Do you think this is appropriate, or did we actually prepare them enough? Were there, was the CI's expectations a little too high? Or can we adapt the program in some way to address what this CI is saying? And so we take it under consideration and we debate it quite heavily. We take their feedback very seriously. Mr. McKeever. Okay, so do you guys understand the 2 things that your CI has to turn in for you to get a grade? 2 things. I try to keep things very minimal for them because they have so much work to do, but I can't get away without these 2 things, okay? I can't give you a grade without these 2 things from them, okay? So all the documents are required. In the past, a few students here and there have been like, oh, I didn't really understand that. I didn't think this was necessary. And I'm like, everything is necessary because I have taken out everything that wasn't necessary. All right, if it's on your checklist, it's necessary. And I have to have everything by your last day. Why do you think I'm saying your last day and not only by August 30th? What do you think?
Because the hours vary at clinics.
Yes, there are some clinics where students are going to do 4 10s, 4 days of 10 hours, and they're going to finish before August 30th. I still need all of their paperwork by their last day. It could be August 29th. It could be the 28th. So I need their stuff by then. Then we may have students who don't finish their hours until September 3rd. Okay, so I'm not going to make them turn it in August 30th. I need their stuff on their last day, September 3rd. Okay. Okay. Electronic timesheets. So I kind of already covered a lot of this already. Yeah, so you're going to go on your cell phone to the my.pmi.edu website to use your timesheet function. Let's see. Right, and don't forget, don't submit it to your CI except at the end of every week. So that's on a Tuesday. Don't submit it you have to enter your hours, but don't submit the timesheet until the end of each week. When you submit it to your CI, they get an email with every day's hours that you clocked in and out, and they either They either hit approve or not approve. There's buttons in their email. That's all they have to do is approve or not approve. If they don't approve, then it gets sent back to you to be corrected to the correct hours. Okay. These electronic timesheets are going to be new for CIs. We've been doing paper or Blackboard until now. And so if they have any problems, that's my job. Send them directly to me. Have them email me or call me and I will help. If anyone is going to be at multiple locations, in other words, if you're at like the Northwest location on a Monday and then the central location, you know, they have a different clinic at a different location and you're there the next day, talk to me. There's a little bit of a tweak that you do with the timesheet entering thing. But I don't want to, it takes a while to work through that. So I'm not going to teach everyone how to do that. I'm just going to work with individuals who need that. Okay. So you would just contact me about that. There is a training video on how to use the timesheet and there's infographics too. And that's on the student portal. If we have time, I would like to play it later or I can have Mr. McKeever play it at the end. I'm just making a note about that.
Yeah, either way you want, whatever you want to do, Dr. A, I'm okay with either.
I think I'll do that at the end. I want to do all the talking first, I think. This pathway actually is a pathway that goes into faculty. So I can pull up the training video from there, or I can, or you can find it on student portal if we run out of time here. I have to check on this. Do you guys, are you looking on your phone right now? Are any of you on the student portal website?
Yes.
Can you click into Complio and see if the timesheet is there?
Mine is there, yes.
Did you have to go into Complio first or did you see the timesheet?
On the bottom of the scroll menu is the timesheet button. So I just clicked on it and then it automatically took me to the clinic name and then it says clock in, clock out or out.
Okay, I probably already set yours up. That's fantastic. Okay, great. So I need to take this Complio thing out. That's incorrect. Okay, so I wanted to look at forms. So give me a second. Oh, I don't have to show you the timesheet. So let me see. The next one is, oh, safety orientation, right? Okay, safety orientation. Almost there. Okay, so this is one of the forms you will do on the very first day. This is required by our accreditation agency that students understand the safety, measures that your facility has in place. And it's for your safety in case of earthquake, fire, active shooter. Those are the main things. So if there's a safety manual, they should give you some time to look at it, or you can look at it during lunchtime, but you should know where it is. You should definitely know evacuation routes for both fire, active shooter, explosion, whatever you might have to endure wherever you are. Shelter locations, some places have actual shelters. Sometimes they're in a basement, sometimes they're in a different place. That's especially important for students who are in, areas where there are fierce storms like tornadoes or things like that. save the PMI portal login page to my home screen. That's a good idea. Great. Definitely location of fire extinguisher. That's definitely important. Review any particular safety policies and procedures that they have. You know the ones for, well, maybe you don't know the ones for school. I don't know if we've done an evacuation drill at school with you guys, but we do have a policy and procedure at school that we practice every couple of months. So maybe your facility has that too, and you should ask them where that is. I would add, so evacuation routes, I want to add, you need to know where the staircase is, wherever you are in the facility, because elevator is a bad idea for any kind of emergency. And then any other emergency policies and procedures they have in place. So you see here, it says click here to enter text. You can just, add your initials there. That's you, the student. And then down here, you write the facility name. You write out your name or sign it if you have printed it on paper, which you don't have to do. You can do this on your phone or on a computer, the date. And then you do have to get the signature of someone at the facility who showed you these things. It could be a tech, it could be a receptionist, or it could be your CI, but they need to type their name in. And I will be asking them when I call, because I call to check everyone at the end of week 1. I ask them if they actually signed the form, because I have to make sure that someone really did show you these things. And then you save this document. When it's all initialed and signed, you save it and then you upload it to Blackboard. And that can be done all on your phone. Many students do that. Mr. McKeever, geez. So that's the safety orientation. Pretty simple, right? It's very easy. The hardest part is if you've never saved a document on your phone, the hardest part is going to just be learning how to do that. So you might want to practice that before you get there. Okay, the next document is the CI verification. Let me get to that. Okay, almost there. Here we go. So this is, the link is on Blackboard, so you can go into your Blackboard app and just follow the link, and this will take you to a Google survey. But you can also do this on your phone. There's instructions up here. And again, you need to fill this out. Do not hand your phone to your CI and say, please answer these questions. They already know this information. This survey is put together for you to learn this information about your CI, to ask them and have a conversation. It's really helpful, especially for people who have a hard time talking to someone they don't know. But we also are required to get this information by our accreditors. So, this is a casual way to do it. So you're going to put your name in, facility name. You're going to put in your schedule, because the school has to know where you are at all times and what days we can expect you to be on campus, and your timesheets will be verified according to this schedule. You're going to put in your clinical instructor's name, if they're a PT or a PTA, and you're just going to answer all these questions. Just ask them, like, okay, what kind of degree do you have? Do you have a master's? Do you have a doctorate? Like, do you have an associate's? Do they have any specialty certifications? Believe it or not, we're required to ask them these questions. I know it seems weird, but then again, you're going to put in their email, the phone number that they would want to be contacted by me in case of an emergency. The number of years they have in practice, or the number of years they've been with their employer. You're just going to ask all these questions, and it's not that long. It's going to be like a 10-minute conversation. So, and most of the CIs have done this with students before, so they know what to expect. They know that you're going to ask them these questions. John, you can choose what method makes you more comfortable. You can do it the form completely electronically, or you can print it out and write on it and then take a picture and upload that picture to Blackboard. But I know a lot of students, they just download the form from Blackboard, open it on their phone, they type in the answers, save it, and then put it up to Blackboard. So, okay, so that is the CI verification. So it's just a lot of information about your CI. And that way, after that, you'll be like, oh, wow, they have a master's and they have this kind of specialty, and I feel like I know them better. Okay, that is the CI verification. Then the DOL form. Okay, so I called it DOL because that's an acronym for Documentation of Learning Experiences. And here you just, see, there's just a list of interventions. It's kind of a list of pretty much any intervention possible. And you just go along the right-hand column and tell me which ones you had experience with or exposure to or that you got to observe. So it's everything from sterile technique, therapeutic massage, biofeedback, traction. Okay, and no place is going to have all of these, and you shouldn't feel stressed that, oh my God, I didn't get every one of these, or I only got 10 of these, or I only got 20. It doesn't. There is no right or wrong. You're just going to use this, just these descriptions here. So if you performed the intervention with supervision, you put S. You put S over here. If you performed it independently, then you put I over here. Okay, so you just rate it like that. If you performed it independently many times, then put IX here, or here, or here. And if it was not at your clinic at all, then you just put NP in as many boxes as you need to. So it's super easy. And, you know, you just submit this on the last day to Blackboard. Any questions about that? Okay, that is the documentation of learning experiences. What do we have left? Oh, clinical site description form. Okay, that should be coming up now. Okay, so in the CI verification form, you found out all about your CI, and this form is going to help you learn about your facility. So a lot of this you can either get the information from their website or just walking around the facility and looking at what they have. So the name and the address, you can get all that from the website of the facility. You can even start that now if you wanted to. Where to communicate with them, the fax, the email, the web address, that's the website address. The name of the SCCE, you already have that, and their phone and email. Yep, so when you get there, you can ask them what they required me to send to them. Did they require a background check? Did they require drug screening? Did they require HIPAA education? Some of them do, some of them don't. Some of them I have to send certificates to show that you got that education already. Let's see. Then you just ask anyone who's willing to answer the questions. Is your clinic site certified or accredited by anyone? And not all of them are. Okay, it's a yes or no question. If you're at a hospital, it's very likely that it's accredited by JCO. So then you would just put a check mark here for that. If you're at a rehab center, sometimes it's CARF. And you don't have to see the certificate. You don't have to get proof of it. You just have to learn. Is it accredited? Is it not accredited? the places that are not, they just leave those boxes blank. They put no, and then they leave these boxes blank. So it's not a high pressure situation. You're not having to prove to me that they're a creditor. I already know they are. I just want you to learn what that is and what that means for the facility. Okay, and then you ask them, like, are you corporate owned? Are you private owned? Are you PT owned? Because that makes a difference sometimes, you know, and you're going to start to learn about what that is. And then just check off what kind of facility it is. Check off if it's rural or suburban or urban. What are their hours of operation? I mean, you know your schedule, but are they open Saturday, Sunday? Are they open, you know, longer than your shift? It's just good for you to know what they're offering. What's the student schedule? How many staff they have of each kind in the department. Is it 2? Is it 22? And then just ask them if they have any of these learning opportunities, if they have any of these things, these programs going on. Sometimes students only check one thing because that's all that that place offers. And some check, you know, 8 because that's what they have. It's okay if they don't have, you know, everything or even a lot of those. So you just ask them, do you have this? Do you have that? Or you look on their website and see what they have. This is asking what non-PT people do they have there? Some places don't have anyone but PTs and PTAs. That's all they have. But some places have more, even if they just come in for a couple of hours a week. And it's interesting to find that out for you guys. Okay, and then just put the date down there, and that's it. So that is getting to know the clinic site, the CSDF. And you do, I think that this is due by the end of your first week, because I don't want everything to be due on the last day. And you need to find out what kind of place you're at, you know, within the first week, so you can understand it better. And then the student performance summary, I have that coming up in the, wait, what did I leave out here? Weekly goals, we will get to that at the end as well. So now I want to share the PowerPoint again. Are you guys doing okay? Any questions that I missed? Oops, wrong one. I meant from the current slide. Okay, there we go. So we looked at these forms. I'm going to get into the student performance summary. That's the form that your CI grades you using. Okay, so this is, you know, when students say, what am I being graded on? We're going to talk about that right now. So here are I think it's 7 criteria that I ask your CI how you did and whether they think that you did acceptably. They don't give me a number. They don't say like 85% or 89%. They just say pass or fail, basically. It's acceptable or not acceptable. So safety is number 1. Did the student follow health and safety precautions that you're taught in school? Did they minimize risk of injury to themselves and to the patients? Conduct. Did the student comply with HIPAA laws? Did they keep things confidential? Everything to do with the patient is confidential, right? Sometimes treatment techniques that facility specializes in are confidential. You're not allowed to go and talk about how you treated people, or if it's something that the facility has developed, it's confidential. Did you uphold the APTA standards of practice? Did you follow the PIMA clinical education protocols? Basically, did you use all the things you've learned in PPS, the PPS system? And did you accept feedback professionally without being defensive, without arguing? Intervention is another criteria. Did you perform treatments and data collection tasks that you were assigned and show that you were competent in what you were doing? At a level for your first affiliation. So you're not being judged on graduation level. You're not being judged the way you're going to be judged for your third rotation. And were you able to demonstrate that you're starting to get clinical reasoning? If they asked you, what muscle is this exercise targeting, were you able to figure out what muscle? You know, is it the biceps or is it the wrist flexors? Which muscle are you targeting with a particular exercise? So that's clinical reasoning. Interpretation of plan of care. When they give you the PT eval to read and you read the plan of care, are you able to show that you understand what the plan of care is saying? And are you able to explain how every treatment that you're doing addresses the plan of care? In other words, if they're asking you to apply a cold pack to an area of the patient's body, are you able to describe what that cold pack is supposed to do? And, you know, the fact that the PT put on the plan of care to use modalities that reduce swelling. Okay, so you have to be able to explain what you're doing and show that it's within the plan of care that the PT created. Affective domain. Do you demonstrate maturity? Do you demonstrate compassion for the patient? And that you're trying to understand what they're going through, right? Are you polite to the patient and not rude? Communication. Do you communicate effectively and appropriately? So do you communicate differently with the CI versus the patient? You should. You should use patient language with the patient, and you should use medical language with your CI. So that's what it means by effectively and appropriately. Documentation. Are you showing an ability to at least write some kind of SOAP note, that you have some kind of understanding of the different sections and what go in them? So they're not expecting perfect SOAP notes, but they want to make sure that you're not putting your plan for the next treatment in the objective section. You know, they want to see that you can put something of the right idea in each section. Okay, so the grading options that the CI has is U, which is unacceptable, M, which is meets expectations, which means acceptable. And then some CIs contacted me, and this is a good situation. They said, well, the student is really, really, really good, and I want to give them a higher grade than M. And so I was like, okay, I'll add E. And so E is an option, exceeds expectations, but it doesn't give you extra credit. So it was just that some CIs asked me as a favor to them to allow them to give higher praise. You know, they felt the student was way above what was expected, and they wanted to be able to give them a grade above M. But M is really just the goal, meets expectations. Okay, so any questions about the student performance summary form? And then once they choose either U or M or E, they're going to give you the form and you read it over, and they have a chance to write comments if they feel like it. And then you read over what they wrote, and then you sign it to show that you saw it. And then they have to send it to me from their email. The student cannot send it to me because I can't be sure then that the student hasn't changed something on it. So I have to receive the student performance summary from the CI by your last day. All right. Any questions? No? I see a chat. Let's see here. Cool. Okay. I know you started to learn some joint mobilization, like the theory and possibly some hands-on stuff in kines class, which is good. Officially speaking, the APTA does not include joint mobilization as a skill for the PTA, but many clinics want PTAs to be familiar with the concept, and they've asked the schools to teach it. So we do teach it, but joint mobilization is not part of, it's not part of the skill set that you are ever graded on. And so what we need you to do in clinic, it's okay if your CI wants to work on joint mobs with you, not of the spine, but of the shoulder and extremities, maybe the knee. No, we don't know anything about joint mobs because PTAs, and there's your line. There's your official line from Mr. McKeever. So it's okay if they want to work on that with you, but only after you've had sufficient and, satisfyingly enough experience for you to feel comfortable doing the manual techniques that you are required to master before you graduate, which is passive range of motion, soft tissue techniques, which you are just starting to learn about, and therapeutic massage techniques, which you started to address in modalities class. These are the hands-on skills that you are expected and required to show mastery in by the end of the program. These should be the first thing that you work on before joint mobilization. Joint mobilization is an extra that you can reward yourself with after you feel like you have done passive range of motion quite frequently for all the joints in the body, shoulder, elbow, knee, hip, ankle. And if you feel like you have enough of that to show mastery of that your CI is satisfied with your skills in that, then you can start doing some joint mobilization if your CI wants you to do that. But a lot of PTA students go all the way through their clinicals and they don't do any joint mobilization at all, and that's fine, because if you work in a place where they want you to do that as an employee, they'll train you for that. Okay, but really focus on these three techniques because you have to master those, okay? Okay, I already talked about submitting documents by your phone. I think a common question I get from students are, what can I do to prepare for my first rotation? Definitely look at the information, the contact sheets that I sent you, because at the bottom of each, I put specific recommendations for you to prepare for your particular clinical setting. The most important thing to do is review anatomy and physiology. As I stated in the lab the other day, the only way that your CI has to start trusting you, because they're not like faculty, they haven't been with you for 3 semesters in labs to observe you and see how much you know and if you're getting everything right. The first way they have, and the quickest way, is to quiz you verbally on anatomy. And I apologize to anyone who, not apologize, but I do understand people that are, shy or introverted, and they get nervous when people quiz them verbally. Unfortunately, that's what happens in the clinic, and you do have to get used to it. So maybe practice with people, have your partner in school quiz you on random anatomy stuff, make up some index cards, give them to the people you live with and have them quiz you verbally. It's because this is unfortunately test taking, reading and writing sometimes doesn't help you when you're a nervous or introverted person in your verbal skills, and you need to practice that. Mr. McKeever has already started doing that in class, where he's like, mold me, tell me what to do, tell me what muscle I'm using. He's already starting to do that. And I'm going to take that a step further next semester. I'm going to walk up to you during lab and say, explain what you're doing and what muscle is the target of that, because that is what you have to be able to do in the clinic before they will let you touch a patient. And so we have to make you feel a little bit uncomfortable so that you can start to think on your feet and think like a clinician. So it's a skill. Very few people are born able to easily do this. And so you do need practice in it. And that's what we're going to try to give you in school. And that's what this first clinical rotation is going to give you practice in also. So you definitely need to review anatomy, especially for the most commonly treated areas of the body, the knee, the shoulder, the back. Make sure you review your kinesiology so you understand how joints work. Review modalities so you remember the parameters and the precautions. Any post-surgical protocols or precautions that you've learned, especially for the hip. I know Mr. McKeever is very good at drilling that into people's heads. So, you know, make sure that you know and remember what he's talking about. All the therapeutic exercise that you practiced in lab on Tuesday, those are the most commonly used exercises. And that is why Mr. McKeever started with those. And I'm going to be adding to that next semester. Anything you've learned in rehab about gait training, balance, you're going to need to know that in certain settings. Soap note writing, very important. Maybe you may not be the best soap note writer, but you definitely need to understand what goes in every section and what does not go in each section. And then any manual therapy that you've been learning, you're supposed to, hopefully we'll be able to get to PNF to teach you that before you go. Again, joint mob should be last on the list, but massage type techniques, we're not saying that you're going to be a massage therapist after going into this program. You'd have to go through an actual massage certification program to be a massage therapist, but you're going to learn some common massage techniques and soft tissue techniques, and of course, stretching techniques. And so you'll want to be feel comfortable with the most common ones like hamstring stretching, and I think that's definitely the most common one, but you know, also passive range of motion, especially for the shoulder, because there's a lot of that happening in the clinic. Yeah, it's almost like Mr. McKeever like plans for this stuff or something. So there's a lot of ways to prepare for PTA. So everything that you've learned in the program up till now, you need to know. Anatomy and modalities were in past semesters, but that doesn't mean that you can forget them. It means you have to retain that knowledge, not only for clinics, but for your national test too. Now, you know, Therex 1 is ideally, you know, like in the syllabus, it mainly focuses on lower extremity. We can't teach you everything at once. And so PIMA decides to teach you lower extremity first. And that's fine. You may go into clinic and feel like you don't know too much upper extremity exercises or stretches. That's totally fine. You're going to get that next semester. If your CI says, do you know how to stretch a shoulder internal rotator? And let's say you haven't gone over that yet. I'm not exactly sure what Mr. McKeever has planned, but let's say you haven't gone over it yet because really it's supposed to be in semester 4. You can say to your CI, we haven't had that in school yet, but I would love to learn it from you or observe you doing it. Okay, so you can come across as very positive while admitting what you have not learned yet, because you don't want to cover up things that you don't know, okay? This is a very common scenario that students tell me they undergo almost on a daily basis. Their CI will say, hey, do you know how to do this? Hey, do you know about this disease or this condition? And the student's like, whoa, he's just really asking me on the spot. And maybe you learned it in school, but you forgot. Don't try to cover it up. Don't try to make stuff up. Admit that you don't know something. I think these are the most positive feedback. This is the most positive feedback I get from CIs is when they email me and they say, hey, your student is really I really admire them because they're comfortable admitting when they don't know something, and then they go right away and look it up. And they either review it or they learn what they didn't know. But the CIs are really, really happy with that. They like when students say, gosh, I'm sorry, either I learned it, but I forgot, or we haven't learned that in school, but I'm gonna go look it up at lunchtime or after work today, and I will know about it tomorrow. And then you go in after lunch or tomorrow, and you say, I looked that disease up, and here's what I learned, and here's what I understand now about the patient that I didn't understand before. They like to know that you followed up and that you did your homework. So this is a change. A lot of students come from a background, from families or schools or other programs or degrees where they were made to feel embarrassed when they didn't know something. And so what they did as a defense mechanism is they learned never to say, I'm sorry, I don't know that. They would say, well, they never taught it to me in school, so I shouldn't be expected to know it, or they would say, well, that's not important. I didn't think that was important to know. Like they'll just say something that's really defensive and unprofessional. And here I want you to know that they are looking to see your honesty and your self-awareness and your insight. They want to see that you can openly identify what you don't know, but that you're willing to go and learn about it. And the CI is not going to teach you everything. You've learned the basics in school. Now you need to go and look it up in your textbook or on a medical website and learn about it, and then go back and tell them what you learned. They love that, and they will give you very high grades for that. If you don't do that, if you don't go and look it up and you don't report back what you learned, then I get calls or emails and I say, well, they didn't know about this, and I told them to look it up and they didn't know anything about it the next day either. That looks really, 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 really bad. It looks like you're not a motivated student and not someone that they would like to hire or recommend for anyone else to hire. Okay, so it's as clear and easy as that. Do homework at night and tell them the next day what you looked up and what you learned in a sentence or two, not a whole half hour. They don't have time for that. But come in and say, hey, I know we identified that I didn't remember about what MS was caused by. I looked it up last night. It's caused by this and this and this. And now I understand why this patient that we were working with is at the stage that they're at. Done, good, let's go treat the patient. Okay, that's how you make yourself look good to a CI, and how you keep learning. If you ask a question one day, like you should ask questions, for instance, if you run up against a disease you've never heard of, because we can't teach all diseases here, or you would be here for 10 years. So we teach you the most common ones. But if you run into a patient who has a disease you've never heard of, and you ask your CI away from the patient, not in front of the patient, like, hey, sorry, I just have never heard of this disease before. And they say, that's okay. What do you think you can do about that? And you say, okay, I'm going to go look it up and I'll know more about it next time we treat them. Then don't come in the next day and say, oh, I didn't, what was this disease from again? I can't remember. I even looked it up, but I can't remember. Don't ask them the same question twice, because that looks really bad. It looks like either you didn't do your homework, you didn't think it was important enough to remember what you looked up, or you don't have a good memory, and that's dangerous in the clinic. That's a safety issue, and they can't pass you if there's any safety issues. So try as hard as you can not to ask the same question. Now, if you come in and you're like, oh, I looked up the disease, I know what it's caused by, and I know what some of the most common effects are, but I just saw on the chart they're taking this particular medication. Do you know if this medication is for that disease or what exactly? That's kind of a different question, so that's okay to ask. Or you can just not ask it and go look it up yourself. Okay, so they want to see that you're an independent learner and that you take responsibility for looking things up and remembering what you look up. Does that make sense? So this just says what I was saying. So be prepared to look things up every day during lunch and after, and then be prepared to go in and talk about what you learned. you may come up against skills that you didn't learn in school or that they do differently. A really common one is how to make a hot pack. Different clinics have different methods. And your job is to learn learn their method. You learn the school method. Don't be obstinate. Don't say, well, I didn't learn it that way in school, so I'm not gonna do it that way here. Okay, go in and say, oh, I want to learn your way too. Because they may have things at a different temperature. They may have different thickness towels, so they don't need as many. They may have, maybe their patients don't tolerate that much heat, so they use more layers. I mean, they have their reasons for doing what they do. And you're just gonna learn their way, okay? Exactly, their hot packs may be made from a different material too. Yep. On the other hand, if there's something that is not in the PTA scope of practice that they want you to do, you have to be able to decline in a professional way. We've had students go out and the CIs were like, okay, I put these dry needles in, now you take them out. And they're like, oh, we have the techs take them out, so you can take them out. No, absolutely not. Now you don't shake their head and say, no, absolutely not. Like I am. You say, I appreciate the offer, but I know from school that that is out of my scope of practice, but I would love to observe you doing it. And so you can turn it into a positive observation opportunity, because you do need to observe skills that are not in your scope of practice by PTs or by OTs or anyone else to expand your knowledge, right, about how everyone helps a patient. So you can say, I would love to observe it, but it really is not in my scope of practice, and so I can't actually do that. And I'm sure you'll understand that I have to decline to do that. Okay, so you can practice that. So, I mean, practice actually saying it like actors do, so that when you run up against it, you're not so shocked that you forget to do it. It's really important that you can do that. Like if someone says, I'm going to teach you how to do a MOB on a spine, it's okay. You're with me. I'll teach you. You can, again, as much as I would love to do that, it's not in my scope of practice, but I would love if I could observe you doing it, just so I have that experience of observing it. Okay, so turn it into that kind of positive educational experience. I don't think I need to encourage you to do this anymore, any more than we already have. I think we've encouraged you to be as careful as possible. And there's always something more you can add to your protection level if you would like to keep minimizing the risk. So this is really ironic. The meaning of exposures, it has different meanings. Like there are actually some PTA students that will be treating COVID-19 patients. And so when you're working with a COVID-19 patient, the fact that you work with them is not going to be an exposure, because you're going to have information ahead of time, right? And you're probably going to be very, very, very extra protected with probably a full body suit, goggles, and all that stuff, right? At some facilities that do not accept COVID-19 people, like outpatient places, they don't want anyone there who's COVID positive or has symptoms. And so an exposure there is going to be if anyone calls in and says, oh, I've just tested positive. If a patient calls and says, I was there yesterday, I just tested positive for COVID, that's an exposure that was unexpected. And so then you have to do everything like we're doing right now at school, because it was an unexpected exposure, right? And you're going to follow your facility's policy on that. Every facility has a different policy. Some are following the WHO, some are following CDC, some have a different corporate policy. And so what will happen is you and the CI will contact me, and we will all work through the exposure event together. We'll follow their policy, not the school policy. The school policy is for school grounds. Their policy is for their property. Okay, So it could be any mixture of quarantine, testing, contact tracing, or maybe nothing at all, maybe just observing symptoms. It's different for every place. All right. Whatever their policy is, I adhere to that. If I have 2 students with exposures and their facilities have different policies, I follow their individual policies. Okay, I don't impose my own policy on anyone. Or the school, I don't impose the school's policy on anyone. Okay. And the thing to remember is what I wrote down here, we're just going to try to be resilient and optimistic. Okay, even if worst case scenario that you can't continue in the program for whatever reason, you get sick or whatever, we will still help you get through the program. It just may not be with the graduation date you had originally thought, but we will all try to be resilient and work through this, because even though the pandemic's been going on for a year and a half, we still feel like we're on new territory almost every day, trying to figure things out. Okay, PPE fashion show. So I just wanted to show you the variety of PPE situations that students have been in. Every facility is different in what they require. And some students choose to do more than what the facility requires. So here's some recent PTAs in the field. Someone at Sunrise, double masking. She has a fabric mask over an N95 and scrubs. Let's see. This was her very long description. She never takes her mask off except lunch. She also wore a face shield, and they sanitize the face shield. They sanitize their shoes, their pens, their badge, watch, everything. They get new masks. The staff was given new masks every day, but students were only given new masks every other day. So they had different policies for staff and students, which is interesting. And this student would be given a new mask at night, and she'd have to take it to her car so that she could wear it in the next day. She couldn't come into the hospital with an old mask. She'd have to wear the new mask in. So there was a little planning that went on. And I guess some people were putting antibacterial, antimicrobial shampoo into their hair before they went home, because they didn't even want to walk into their home. They didn't even want to walk through the living room to their bathroom to take a shower without sanitizing their hair, at least somewhat. But you can mitigate that by covering your hair. If you're the kind of person who's going to be working with COVID-19 patients, you'll want to cover your hair so you don't catch all the virus in your hair. So here's at Valley Hospital. This person was working on the ICU, which I imagine she had some active COVID patients. So she's got her hair covered, right? She's got eye protection, double mask, scrubs, booties, gown covering the scrubs, gloves, everything, pretty much everything covered except forehead and neck. On a different floor, on the med-surg floor, this is what she wore: face shield, mask, hair covering, and scrubs. And then she would take the hair covering and scrubs off before she got in her car. This is at a rehab center, not a hospital, but there were very sick COVID positive patients here. This is a student wearing this outfit because they're going to go treat a COVID-19 patient. And he was very excited to do that because he knew he was going to help them a lot. So he wore a full body bunny suit, which has a hood, so it covers the neck too and the forehead, face shield, N95 under the face shield, gloves, foot color covers, and a gown over the bunny suit. And here he is showing how you can exercise in all of that gear. This is an outpatient facility that treated pediatrics. She's double masked and has a face shield and scrubs. This is at an outpatient. Some people are wearing gloves, some people are not. Everyone is masked. Some just with surgical masks, some with cloth covers. Okay, so you can see there's going to be all different kinds. If you have a choice, wear the maximum protection if you're interested in reducing your risk and having the highest chance of getting through it. Okay, so some students ask me, what am I required to do? And these are in the next few slides are some things that you are required to pursue by our accreditation when you're at the clinic. So try to keep these in mind and look for these opportunities. One is interprofessional practice, which means watching people that are not PTs or PTAs. So if your facility has OTs, massage therapists, athletic trainers, nurses, doctors, respiratory, chiropractors, anything else medical, or front desk, billing, we want you to spend, I don't know, half an hour observing them. We need you to start understanding how other people are helping the patient as well, the whole healthcare team. So if if they say, hey, do you want to observe the athletic trainer for half an hour? Yes. Hey, do you want to observe the massage therapist? Yes. Say yes to everything. Because when you are employed as a PTA, you will never get the chance to observe anyone else again. This is an opportunity students have, but you're not given that opportunity when you're being paid because you have to treat and bill for your treatment, okay? So as you can see, this is required by our accreditation, and that is the exact standard CAPD 6J3 that addresses. Participation as a member of the PT-PTA team. This might be obvious, but it is stated by our accreditation. If your CI is a PTA, you want to try to have interaction with your supervising PT as well, whether it's by telephone or just saying hi to them every morning or thanking them for being your supervising PT. Or if they have different patients you can go and help with, while let's say you have your PTA, your CI who's a PTA got a cancellation, but your supervising PT as a patient, go observe that or help them with the treatment. So you want to have interaction with your PT team, okay? Well, I see a chat. Yay, Brooke, very good. Nice. So let your CI know when you go into the, not just Brooke, but everyone, let them know that you really want to observe everything you can, whether it's PT or not. And that will help to set you up for good interactions and getting this kind of experience that you're required to get. Right, and one of those things that you might do within the PT team is educating the PT about what it is that a PTA does. You may have a CI who's a PT and never had a PTA student before, and they may not be clear on what you can and what you can't do. And so you educating them about that is considered, that kind of team member participation. Promoting a positive working relationship. What does that mean? Don't be sarcastic. Even if you think it's funny, hold off on the sarcasm until they get to know you and then test the waters and see if they're okay with that. Sometimes that makes people uncomfortable. It makes them feel like you're creating a hostile environment and you don't want that. So if you're a sarcastic person in your real life, then you want to hold off on that. As a student, it really could be interpreted wrong, and you can't afford that. You only have 2 weeks to make a good impression. Actually, you literally only have 1 hour to make a good impression. So be sincere in your communication. Don't use sarcasm when you're first working with people. Don't complain about anything. Don't walk in and say, "Oh my God, the drive here. Oh my God, I had no idea." Just keep it to yourself. That's what being professional means. Keep all the negative stuff to yourself and only say, "Good morning, I'm so excited to be here. Who's our first patient? I really would love to read the chart." Okay, so put on your professional character, keep everything else inside. Don't argue with anyone if they say you did something wrong. Ask them, okay, how would you like me to do that? Show respect for everyone's roles, PT or PTA, and look for ways to collaborate with the PTA. If they need help with something, volunteer to help. When we used to have health fairs, I would encourage students to do the weekend health fairs with their clinics if those were happening. And also when you look things up at night and you go back in and you talk about it, that's being a positive part of the team as well. Another thing that I have been encouraging you to do, but is actually stated that you need to look for this, is a variety of experiences with patients of all ages and at every stage of disease and injury. That's the continuum of care, is every stage of injury and disease. So let's say you thought you were only going to treat adults, but then someone in the clinic has a pediatric patient. You could say to your CI, hey, do you think it would be possible if I could observe that pediatric treatment? I have no experience with it, and I kind of want to be exposed to as much as possible. That's the kind of opportunity you want to look for. Or if you're working mostly with children and someone has a geriatric patient, you could ask to observe or to help with that treatment too. If you're working in a hospital or a facility that has different types of clinics like inpatient as well as outpatient, you could ask to spend some time in each of those. And you want to see as many conditions as you can. So if, let's say, your CI has a lot of back patients, which is great because you'll get really good at that. But then let's say there's some extra time and someone else in the clinic has a shoulder patient, you could say, hey, can I go observe the shoulder patient? As long as you don't have responsibilities, with your CI to treat. You don't want to run away from treatment that's already on your plate. It's just if nothing's going on or you have a cancellation and there's something else to see, then you should look for those opportunities. Okay, as licensed practitioners, it's in the law that you have to report abuse if you suspect it. You don't have to have proof. All you have to do is suspect it. And then when you call it in, they will go and look to see if it is truly abuse or not. And they're not going to discipline you if it's not. They are going to discipline you if abuse is reported or found later on and that person was your patient and you saw signs of it and you did not report it. You could actually lose your license for not reporting it. So if it's a child that you suspect abuse, either because of bruises or behavior, or they're coming in and they're, dirty, smelly clothes that haven't been changed. It could be neglect, or homelessness. You do need to report that too. Okay, and this is the number. You can find this online if you don't have access, obviously, to this slideshow. But you just look up Clark County report child abuse or something like that, and you'll find this number. Okay, and this is also part of accreditation for our program, is that you understand that you have to report abuse if you suspect it at all. Also, elderly abuse, there's a special number here for Clark County. You can find that by Googling that as well. If you suspect abuse in just an adult, like an adult female or adult male, that's a crime. And so there's no special number. You just call the police department and report that you suspect abuse. In and out of the clinic. I don't know if you're expected to do that when you're not on duty. I don't know if Mr. McKeever knows the answer to that or not. Definitely in the clinic. I'm not sure about outside the clinic.
Yeah, it depends upon it depends upon your own ethics at that point. If it's child abuse, we are required to report it no matter where we are, whether we're in the clinic or out of the clinic. Elder abuse, I think, is another one, but I don't know about like spousal abuse and stuff like that. I don't know if that's required when we're out of the clinic, but I know that elder and child abuse, even if we're outside the clinic and we observe it, we have to report it. Because we're a licensed professional. We are what's called mandated reporters.
Okay. Thank you for that. Okay, and then some warnings about things not to do. So I've been talking about what to do and now some warnings about what not to do. There's a label called difficult student in the clinic. And it's very easy to get this label and very hard to get rid of it, if not impossible. And so I want to help you guys avoid getting this label. A student is labeled a difficult student if they're lazy, if they don't accept feedback, like if they refuse to accept corrections from their CI, if they refuse to do things that are in their scope of practice, like treat a patient at all, and if they decline to learn the CI's techniques, like I said about the hot pack. If a student is like, well, that's not how I was taught in school, so I don't think I should have to do it that way in the clinic. That's being a difficult student. And at that point, the CI has every, they can try a couple more times, but if the student has an attitude like that, they could actually terminate the student. And that's termination from the program. So that's when being a difficult student gets taken way too far by the student. Keeping your negative feelings to yourself. Like like I said, if you get known for being a complainer or just constantly saying negative, finding the negative in a situation, that's being a difficult student. Bring your personal problems to the clinic. If you walk in and say, oh my God, I just had the worst breakup of my life, blah, blah, blah. It's okay that you feel bad about things, but you can't bring that into the clinic with you. When you walk through that door, your mind has to be on the patient, not on your own personal life. So it's okay that you're mulling things over in your head about whatever situation you have in your personal life, but don't talk about it in the clinic, okay? Maybe once you start working at a place and you develop a particular relationship with people, you can start being friends, but don't think of your clinic practicum as a place to make friends. It's a place to be a student PTA and to learn to treat patients and not to bring your own personal stuff into the clinic. If students who have schedule issues, they show up late, they ask for changes in schedule, which again is not allowed. But even just to ask for it is considered being a difficult student. Students who have their cell phones out at any time but lunch break are labeled difficult students. And they're not going to say, you just got yourself labeled as difficult student. They're going to talk about that amongst themselves and they're never going to tell you because they know that that's not going to change the student. That's just a label you're going to have forever with that clinic and with anyone who's there. And students who disappear. There have been students that left the clinic floor and they told me later, oh, I went to find a quiet place to write my soap note, but they didn't tell their CI where they were going and they didn't tell their CI their need. If they need a quiet place, that's fine, but you have to work that out with your CI and they have to know where you are at all times. So that's how not to be a difficult student, not to get labeled that. And believe me, as soon as the student is labeled difficult, I get an email about it from the CI. They're like, I don't know if this student's going to be able to pass. They're a difficult student. And I'm like, oh my gosh, I'm sorry. I tried to explain to them how not to be difficult. So, if there is an issue that's really bothering you about the clinic, you have two people to talk to about it. You have your CI, first of all, and you have me. And if you're not sure how to deal with a situation, talk to one of us about it. And we'll try to help you through that so that you don't do something that gets you labeled difficult. And we know that a lot of these situations are new to students or they have old, less positive ways of dealing with it. And we want to help you find more positive ways and more professional ways of presenting yourself in these situations. Remember that no clinic is perfect. None of these clinics or facilities or hospitals, none of them are set up as student programs. They are all real professional programs, and they're kind of carving out room and time for you to go in and see how things are really done and what the real world is like. It's very different than school. School is a good starting point, and it's a good place to learn the basic knowledge. But you can't learn the realities of a clinic in school. That's why we have rotations and internships. So these are the kind of imperfect situations that students have called me about and said, should I switch to a different place? And I had to tell them, no, I'm sorry. This is just a sign that you're not in like, you know, a perfect, because there's no such thing as a perfect clinic. There's no such thing as a perfect CI. And what we need to do is be resilient, work with it, learn everything we can, and understand that no place and no person is perfect. So things like my CI has garlic breath, so it's hard for me to be in a room with them. My CI has opposite political views. Don't talk about politics. If they start talking about it, turn them back to, I have a question about the patient. Can we talk about that? So redirect them. We've had several clinics that had plumbing emergencies. They had floods. And the student walked in and half the clinic was sopping wet. And they called me and they said, should I switch to another clinic? I'm like, nope, that is reality. They need you. They're still having patients. They need you to treat the patients, and you have to adjust to what's available, to the area that's still dry and the equipment that's still usable. And it was a really good learning experience for them both times. Your CI may not be an absolute genius. You don't have to be a genius to be a good clinician. You just have to be safe and effective. And there's a lot you can still learn from someone, even if they haven't read the article that came out last month on the best exercise for the knee. They have years of experience and they know individual patients, and you're still going to learn important and useful information from them. Patient diagnosis. Maybe you're seeing more back pain patients than you thought, and you're not seeing as many shoulders as you were hoping. That's life. That's what it is to be a clinician. You see what walks in the door. You don't get to pick and choose usually what you see, unless you work up to that, or it's in your contract that you're only going to see shoulders. But I don't actually know anyone who does that. I know surgeons that do that, but not PTs or PTAs. I get calls from students saying, well, the staff, one person on the staff is really mean to me. Well, not mean, but they're like unfriendly, and they told me they don't like students. Are you sure I should be there? And I'm like, yes, because your CI asked for you. Your CI wants you there, and that is all that matters. They're willing to teach you. It doesn't matter what the rest of the staff says. It's just like a place of employment. Maybe not everyone there likes you. Maybe you're not friends with everyone there. You still have a job to do. You're not there to make friends. You're there to treat patients and make their lives better. And then a couple of times students have called and said that, there's a couple of staff people that just keep asking me personal questions like, what's my sexuality? Am I married? Do I like to party? That kind of thing. Or be careful of that other person. They're mean to everyone. So you don't want to make sure you don't have to treat anyone with them. Well, you can't be taken up by these other people's drama. You have a job to do. You're there to learn, and you may have to work with the person they say is difficult. Doesn't matter. You have to make the best of it. This can all happen at a regular job, a regular place of employment. And like I said, no place is perfect. You make the best of it. There's always something to learn, and your CI does want you there, even if no one else does. And that's all that matters. Some students are like, my CI they're a PT, but they're not a DPT. Is that bad? It's not bad. If they're not a DPT, that means they have a master's or a bachelor's or even a certificate if they have been a PT since the 70s. And that means they have decades more experience than any DPT, because DPT is a new kind of degree. And their experience is extremely valuable and very, that's like an honor to be with someone who's had decades of experience. So it doesn't matter that they don't have a DPT. May not have tons of contact with a supervising PT. Try to get as much as you can, but if your CI is a PTA, that's who you're going to be interacting with, day in, day out. Your CI may make mistakes because they're not perfect. The clinic may be losing staff, or they may add staff. And so you may have your patient load may change because of that. It may get heavier, it may get lighter. COVID-19 might have a lot to do with that, but I've been in situations like one time I worked for Select, and I was supposed to be taking over for someone who was pregnant. And I walked in, I was supposed to have like 2 weeks of orientation to meet the patients and get to know where everyone was at. I walked in there like, I think her name was Lisa or something. Lisa went to the hospital today to give birth. I'm like, there goes my orientation. All right, bring them in. I'll just figure it out. You know, I'll read each chart really quickly before each treatment, but I don't get an orientation. Oh, well, that's life. So that could happen too, or someone could get fired and then suddenly you have to take some of their patients with your CI. So you adjust and you do the best you can. There may be other PT students or PTA students at the same time. That's actually an advantage, not a disadvantage. Your CI their mind could be on something else. They could be studying for a specialty. They could have medical issues. You never know. You may think that they're being a little distant, but you gotta give them slack. You know, people have other things going on in their life. Again, they asked for you and they're gonna show you as much as they can about patient treatment. So final point, be professional, make the best of it. There's always something to learn. Respect them and thank them for their time. Okay. I'm trying to get through all this because I have to go somewhere at 3. Okay, if you have something wrong with you, do not ask them for treatment or advice. This is a huge no-no. It's an unspoken rule. And when I get phone calls from the clinic saying your student is asking for treatment for their back pain, why didn't the school educate them that they shouldn't ask for that? So here's my slide on that. Don't ask for treatment or advice on your own physical problem. Okay, that's considered unprofessional. It's not written anywhere, but it is understood because you're taking time away from treating other patients and you're taking time away from them, from other staff doing the things that they need to do. So if they offer to try something out on you, you can accept that one time, but don't ask for that again. If they ask you if they can do it again, you can accept, but don't ask for it again, if you get my drift. Thanks, Mr. McKeever. Don't expect special treatment. Okay, you're there to be a student PTA, not to be a patient. They're gifting you with their knowledge and their experience. Be sure to abide by any facility policies that they bring up. COVID-19 is one thing, their phone policy, break policy where you can and cannot take breaks, when you can and cannot take breaks. You may not be able to take any breaks except for lunch. Then so be it. You work 4 or 5 hours at a time with no breaks. That's the way it is. That's clinic life. An eating policy where you can and cannot eat. Along the lines of eating and drinking, I want you to know that COVID-19 does not magically disappear from the air when you're eating. So if you can go out to your car and eat, that is best. So you're not taking your mask off in a common area. Social media and HIPAA. This has been a problem with PIMA, with some previous PIMA students, not in Las Vegas, but in other programs. And someone actually posted, I think it was on Twitter. This post I have, where's my pointer here? I have 7 patients, oops. I have 7 patients tomorrow. I hope it rains. How does that come across? It comes across like that student doesn't want to see so many patients. It comes across as complaining, as unprofessional. And so that program had to take action against that student. And the possible consequences are dismissal from the program because they're bad-mouthing their internship, a fail of the clinical internship, or a deduction of PPS points, remediation activities, and things like that. And that program had to make that decision of what to do. So, you know, the best thing to do is don't put yourself or me or the program in that position. PEMA has a long policy on social media during externship. This is the slide on it. And it says here, students must not engage in any activity that reflects negatively on a clinical affiliate. An affiliate means facility. Students may not disclose confidential or proprietary information. Students must not ask to connect with anyone from the facility, including staff, patients, employees, or anyone. So don't friend anyone. Don't connect, don't follow them. Don't do any of that because it can all be misinterpreted later on. Let's see. Students are personally responsible for anything they post that could violate HIPAA. So the best policy is post nothing about your clinical rotations. Nothing on any social media channel. And I know that's a brand new concept for you guys, not to post anything. Just do a media blackout for everything to do with your internship. Don't talk about it on social media. Okay, as part of being professional, I can't post anything on my social media about jobs that I work at or places where I'm treating patients either. It's just part of it's part of being in healthcare. It's illegal to date patients. If you're licensed in Nevada, it's illegal to date patients that are under your care and for 3 months after their discharge. You can lose your license if you do that. As a student, you could be denied your license if you do that. Also, you should not treat your own boyfriend, girlfriend, or spouse. It's created so many bad situations in the past that is the best way to do it. But it is actually under Nevada law illegal for you to date patients that are under your care. So don't do it. Don't party with patients, don't date patients, don't go to their homes unless you are contracted to do home health. Don't accept gifts worth more than $25. And don't give someone special treatment just because you relate to them. Everyone deserves the same level of care. Some students are offered jobs during their practicum, usually on their last practicum because it's closer to graduation. And that it happens, it's really rare, but someone will be given an invitation to interview. That's less rare. That happens a little more often. But the best thing you can do to secure a job after graduation is be spotlessly professional. You don't have to tell them you're looking for a job. Of course, everyone is after graduation. But if you show how professional you are, they're going to remember that. And they're either going to call you when they have an open position, or they're going to be able to give you a very good reference. If you're a difficult student, neither of those is going to happen. And that you can be labeled a difficult student within the first hour you're there if you demonstrate those characteristics. So be very careful, be very professional. Don't talk about personal stuff. And don't ask for a job. That's considered another unwritten rule. Don't say, hey, I definitely need a job. Do you guys think you can hire me? They're not going to hire you. They'll say, oh yeah, you can, they're not going to be confrontational and say, absolutely not. Now that you've said it that way and you've been rude and asked us for a job, they're just going to say, oh yeah, you can interview when you're graduated, but they're simply not going to hire you because you were too unprofessional in how you asked. So never ask for a job. If they encourage you to apply, that's great. Just say thank you, If you never get the practice, if you never get to be in a setting that you think you want to work in after you graduate, if you never get to be in that setting as a student, it's not going to prevent you from getting a position in the setting that you want to be in later on. So if you never get inpatient as a student, you can still apply and get hired. It depends on how you interview and what the caliber of people are that are also interviewing. So don't be upset if you never get what you really, really want. It's not going to prevent you. I never got a performing arts position as a student ever. I barely got an orthopedic spot. And that didn't prevent me from going into performing arts. What prevented me from going, what I did have to go through is I had to do a whole bunch of specialty courses after graduation. That's what I had to get before they would hire me. It wasn't about where I did my internships. It was about the training I was willing to do on my weekends after graduation to be in the setting I wanted to be in. I don't think we have any holidays while you're on your practicum, so I'll save that for another time. We talked about this. Do not ask for schedule changes. You have to do the schedule your CI gives you. And that may include days when your CI is not there. Just because your CI is not there does not mean you get a day off. Okay, wrapping it up. Ask questions when you're not in front of the patient. CIs like questions because that means you're paying attention and you're thinking about things, but just don't ask it in front of the patient. Ask it later. Look things up that you don't know as soon as possible. Show your eagerness to learn and to research and to try new things. And remember, it's okay to say, I don't know a particular thing, but I'm going to go look it up, and then go look it up. Every day, find something to thank your CI for. If they show you a new technique, thank them for that. If they explain something to you, thank them for that. If they bring up something that you didn't know and you got to learn something by looking it up, tell them that, thanks, I'm not sure I would have thought to look that up on my own. You know, and because they're not getting extra pay for having you. In fact, it makes their job actually more difficult because they have to fit in patient treatment and teaching a student. So be sure to show your thanks. And we've talked about that already. Be adjustable. Be able to have different communication styles. Okay, a little more casual with the patient, very professional and formal with your CI. Remember, it's not the CI's job to cater to your learning style. It's your job to cater to their teaching style. Okay, and it's going to be hard work, but pretty quickly you're going to start to feel like you're really helping patients, and that's an amazing reward. So any questions? Let's see. Mara, as far as laptops, you're going to talk to your CI and ask them and say, can I bring my laptop to do paperwork on, or do you have computers I can use? Am I allowed to bring my own laptop? Because maybe not allowed. I don't know. You have to talk to your CI about that. Good question. In some places, the firewall is so strong you can't get on Blackboard from their computers or from their Wi-Fi. So even bringing your own laptop might not solve the problem. That's when you're going to use your phone and use your phone service to get on your Blackboard app. And feel free to email me any questions. I know we're still, I don't know, what, 4 weeks out? So there's plenty of time to ask me questions.
You're awesome, Dr. Breskin. That was amazing.
I know it was a lot of information. Oh, so the, you can, let me open, you can open and download the weekly goals. Where are they here? So the other way that, where is it here? There it is. So I did mention that the primary way that your CI gets to know you and to trust your knowledge is to quiz you. The other thing they're going to do, because they don't know you, they haven't been in school with you for 3 semesters, they're going to ask you straight out, what are your weaknesses and what are your strengths? And that's what you're going to put on this. This is your weekly goals sheet. So for week one, this is due by the end of week one, right? Here's what you need to do before you get there. Write down 3 strengths that you have as a student, mainly that I learned from reading in textbooks really well, or I learned from observing people really well, or I get my homework in on time. I have good handwriting. Everyone has 3 strengths for sure. Then you have to do what used to be embarrassing, but we now know is not embarrassing. It is enlightening. You have to find 3 clinical weaknesses or academic weaknesses that you're going to share with your CI so they can understand what will really help you to work on in the clinic. One that you can all put down is, I have never written a SOAP note for a real patient. So you can go ahead and write that one right in there. Number 2, if you have never done a modality with a patient, or you've never done gait training on a real patient, that should be included. Number 3, maybe your weakest way of learning. So let's say I don't learn the best from reading a textbook. I don't learn the best from a lecture. I learn better from a lab. Okay, so what you need to do right now, unless Mr. McKeever has something else for you to do, is do these 3 strengths and 3 weaknesses. So you walk in the clinic the first day with those done, and then you're gonna show those to your CI, and the 2 of you can think of 2 goals based on your weaknesses. 2 goals that you wanna reach on that first week. Like, I wanna goal 1, write a SOAP note on a real patient treatment. Goal number 2, perform ultrasound on a real patient. Okay? And then you sign it, the CI signs it, and you submit that for week 1. For week 2, you scroll down and you do week 2, which is below it. Okay, so when you submit it on week 2, both the top and the bottom are filled out. So on week 2, you're gonna have to think over your weekend. After this first week of treating patients, what are my strengths and weaknesses now? Because maybe they're different. And then you're going to write them out and talk about it with your CI and think up 2 more goals for your second week. So that's something that you can start today. And Mr. McKeever can, I guess.
I'll come up with something, don't worry.
You want them to submit it to you? I don't know.
No, I think working on it is enough of an assignment. They're here.
Okay.
I'll count them for attendance, but I think that's one good thing they can have. That way they go into clinic. I like students having this day 1, because that gave me something I could work with them right away on.
Yeah.
For sure.
So you can download that form from Blackboard students.
Awesome.
Start working on that. So thank you, everyone. I know that was a lot of information, but it'll feel like old hat for practicum too, because a lot of it is the same. Okay. All right.
Thank you, Dr. Obreskin.
See you guys soon.
Have a good rest of your day.
Thank
Bye.
you.
All righty. That was a lot of information, wasn't it? Whew. Clinicals are scary places. How many of you guys are terrified right now? Anyone? All right. You'll get over that the first patient that poops on you. I mean, first person you work with. One thing I want to mention that Dr. Obreskin kind of brought up that I learned my first week in clinical, always have a spare set of clothes with you. My first clinical was scrubs. It was in an inpatient clinic. And I always have a spare set of clothes, and more importantly, have a spare set of shoes with you, because my second or third patient of the day pooped all over my shoes. I got them up and she had explosive diarrhea. And well, yeah. So always have a spare set of clothes and a spare set of shoes with you. One of the things I do right now to minimize my COVID exposure risk is I wear my clothes into the clinic, the clothes I'm going to wear in the clinic. And then as soon as I'm out of the clinic, I get in my car, I drive home. On my back porch, I have my clothes that I want to put on to go into the house right there. I take all of my clothes off that were in the clinic. I put them in a little plastic baggie, and I take them to my laundry room and drop them in my laundry room. I go up and I get a shower immediately. Even with being vaccinated, I still do that because I'm just paranoid like that. So those are some things you can think about. Are there any other clinical questions you guys can think about, or are you guys fried pretty much?
I had a question, but
Okay.
it might be silly.
Nope.
Going back with Dr. Aveska was saying about if we have to research a disease and trying to get a better understanding of the patient, are we allowed to email you just to be
Yes.
sure what we are researching is correctly before we talk to the CI?
Absolutely. You're allowed to email me. Now, what I don't want to see emailed, because that's a really good question, is I don't want to see emailed, Mr. McKeever, can you explain everything about MS to me? I'd be like, sure, here's a Wikipedia link. But if you email me and say, hey, I'm treating a patient with MS and I saw that they have this, this, and this, and this, is there anything else you can add that I would want to be aware of? That's different. You've done some research on your own. I'm not doing the research for you. One caveat to that is, anytime that you're on clinical affiliations, anytime that I reply to you, I have to carbon copy Dr. Ovreskin. So she'll know that you emailed me. That's why I say make sure that you kind of do some of your own research first, instead of just saying, Mr. McKeever, explain, I don't know, Prader-Willi syndrome to me. Do a little bit on your own. Your patho book's your best friend for that, a little bit. And if not, I know I say don't use Wikipedia for a source, but you can use Wikipedia as a reference to go and start looking at stuff. But yeah, feel free. I mean, same thing with like, I've had students that are like, hey, so I was thinking I'm working with a patient that's got a reverse total shoulder. And the PT wanted me to think of some exercises. So I thought of this, this, and this. What do you think about that? Now be prepared, because I might ask you, okay, well, what's your logic or reasoning for doing, I don't know, Codman's exercises or something, right? But yeah, that's okay. You're okay to email us. It is okay. It's a long way of me saying that.
Okay. And I was just also curious, like when emailing you with information, where does it lead to a point where it could be a HIPAA violation? Because
Just don't. Yeah. So, well, for us, it's okay. You can just don't email us like specific patient information. Saying something like I have a patient with cerebral palsy or I have a patient with COVID is okay. I don't know what specific clinics you guys are in, so I don't know the patients you're going to have.
Oh, okay.
Like I'll ask you guys after your clinics. That's why I purposely don't want to know, so that way I don't ever run into a HIPAA violation.
Okay.
So like, say Daniela emails me about a patient that's got CP and she's at a pediatrics clinic. And I don't know if she is or not, but say she is. I've worked with a lot of the kids in the area. That way I don't know what kids she's working with.
Okay.
Does that make sense?
Yes.
Okay.
That helps. Thank you.
Yeah. Anything else you can think of? If not, that's it for today. I know that this was disappointing, but the good news is we've got this out of the way. We don't have to do this anymore. I will get a hold of Dr. O'Neill and have her see what she's found out about what we need to do, what everything needs to be done. And she should be emailing you guys shortly. I don't know, Amanda, that would be my safe assumption. I'm going to stop recording, actually. There are no more clinical questions, correct? No more clinical questions? All right, I'm going to